All right, welcome everyone, and thank you for joining us. We'll go ahead and get started with today's webinar. We're looking forward to having a great conversation about case-based genetics instruction for PA students. My name is Laura Chiacha West, and I'm the Associate Director of Medical Education at the Jackson Laboratory. Previously, I was an instructional assistant professor at Texas A&M University College of Medicine, where I taught in the didactic preclinical phase of the curriculum. That experience gave me firsthand insight into both the challenges and rewards of teaching clinical trainees, which I know many of today's attendees understand. This webinar is hosted by the Jackson Laboratory, which is an independent, nonprofit biomedical research organization that seeks to empower the global biomedical community in its shared quest to improve human health. JAX Clinical Education is a team of genetic counselors, educators, scientists, and instructional designers bringing more than 10 years of experience crafting clinical genetics and genomics education for healthcare providers and clinical trainees. The focus of today's webinar is the JAX Clinical Education course, Genetics and the Physician Assistant's Practice. This free online course has been in our catalog for over 13 years and is our most popular program. It has been used by 25 clinical training programs throughout the nation and was updated this May to be more interactive and include more practice with family history collection and 2 new differential diagnosis cases. With this update, we wanted to inform more PA faculty about using this resource, which is aligned to PA genomic competencies and is used by programs to meet the ARC-PA genetics instruction standard. I'll start with a brief overview of the course, and then we'll hear from 2 PA faculty on the different ways they've integrated it into their curriculum. This course is a modular program that includes 4 course modules, ranging from foundational genomics here in the genomics primer module through complex clinical cases, which can be found in the genetic risk assessment and differential diagnosis modules. In particular, the genetic risk assessment module includes content on principles of genetic risk assessment, family history collection, and family history practice exercises. Each module begins with a short pre-quiz that is composed of a few multiple choice questions, followed by the interactive educational content that includes embedded knowledge checks. Learners then take a short post-quiz that is aligned with questions from the pre-quiz so that they can track and understand their learning. I wanted to provide an example of these interactive educational content. Here's a graphic from the genomics primer that shows DNA structure at different levels. Students can mouse over terms within this graphic to learn more about each component, from chromosomes to genes to nucleotide base pairs, for example. Interactivity is part of other modules as well. Here's a pedigree from genetic risk assessment that allows learners to explore different red flags for a genetic disease with a mitochondrial inheritance pattern. For example, they can learn more about multiple diagnoses and early onset in this member of the family. I also mentioned that there were a lot of embedded knowledge checks throughout this course. Here's an example from the genomics primer again that tests student understanding of the pattern of autosomal recessive inheritance. Students are provided with this question. If they get it right, then they get a debrief that reinforces their knowledge and clarifies concepts. If they get it wrong, they get a debrief again that allows them to correct their misconceptions, and then they can try the question a second or third or fourth time, as many times as they need to make sure that they understand the concepts being presented. Finally, I wanted to highlight the interactive clinical cases that are a part of the genetic risk assessment and differential diagnosis modules. These cases cover a range of genetic conditions and disorders and diseases, from autism spectrum disorder and early onset Alzheimer's disease, which are new cases that have been added to the course, to disorders of the circulatory system, hereditary cancer, and genetic diseases with a variety of inheritance patterns. As learners work through these cases, the modules focus on skills development, from taking an accurate family history to differential diagnosis to planning management of patient care based on genetic risk assessment or genetic testing results. Through these modules, there's a lot of interactivity and knowledge and skills development. When learners complete all the modules, they get a certificate of completion for the entire course. However, we know from faculty that sometimes it better fits the needs of the learner to complete one module or a few modules, the genomics primer, for example, or genetic risk assessment. Because of this, each individual module also offers a certificate of completion for just that module. We know faculty use our course in different ways to meet their needs. To discuss this further, I'd like to introduce the two panelists for today's webinar. All right. So first, I'd like to begin by introducing Randy Brush. He's the Director of Didactic Education for the PA program at Valparaiso University Master of Science in Physician Assistant Studies program, where he's been faculty since 2018. He's a practicing physician assistant in urgent care and orthopedics and an active member of the American Academy of Physician Associates and the Indiana Academy of Physician Assistants as past president. I'd also like to introduce Maryann Campion, who is the co-director of the Master of Science program in Human Genetics and Genetic Counseling and professor in the Department of Genetics at Stanford University. Since 2016, she has taught genetics at the Stanford School of Medicine Master of Science in PA Studies program. Maryann was the founding director of the master's program in genetic counseling and assistant dean in the Division of Graduate Medical Science at Boston University School of Medicine. Her clinical career has focused on prenatal genetic counseling at the Greenwood Genetic Center, Boston Medical Center, and Stanford Center for Down Syndrome. Thank you both so much for joining us today. So for the participants today who are attending, there will be time for Q&A for both Randy and Maryann at the end. If you have any questions, please use the Q&A button, which will be at the bottom of your screen. If you're having any trouble finding it, there will be three dots that you can click that will bring up that Q&A button as well. All right, so we'll jump right into the questions. I have questions for you both. I would like to know a little bit more about the genetics that you both teach to PA students. And I'll start with Randy. If you could tell us a little bit about how you're teaching genetics to your students.
Well, in our modular curriculum, we teach the bulk of the initial genetics early in our first semester, which is our course called PA 510. This helps provide students with a strong foundation in genetics before they continue to learn on genetics in their specific modules throughout the entirety of our curriculum.
All right, wonderful. And Maryann, could you tell me a little bit about the genetics that you teach to PA students?
Sure. I work with them as soon as they arrive. So it's their first quarter of training, and it's 4 threads woven into one course, genetics being one, and then also biochemistry, microbiology, and immunology are taught that quarter too. And it's part of trying to frame genetics as being applied across healthcare settings. We have about 26 students in the class, and it's a really great way for them to kick off their training.
Okay, wonderful. So thank you for sharing that information. As I'm sure you're both aware, and all of our attendees are likely aware as well, genetics is one of the requirements for PA education in terms of accreditation. So the ARC-PA standard B202 specifically cites that genetics and molecular mechanisms of health and disease have to be taught to PA students as part of an accredited program. I was wondering if you could tell me a little bit about some of the challenges that you may face in teaching genetics to PA students. And Maryann, I'll start with you.
Sure. I also taught physician assistant students when I was at Boston University. And I remember when I first began putting that together, I really struggled finding clinically relevant genetics content that would be appropriate for first-year PA students, especially given they were all coming into their training from varying levels of exposure and experience with genetics. So we were trying to find something that could level set the material so that they would all start on the right foot. It's also hard to find information about how genetics and genomics actually shows up in medicine today, and making sure that that material can be useful in discussions, because that's a really big part of the way we teach.
Okay, great. Randy, how about you? What are some of the challenges you've dealt with in teaching genetics?
Well, honestly, I've seen most of the same things. My biggest challenge is bringing all of the students to the same level in terms of their genetic knowledge. It's pretty ironic that most of our students come from our own institution, but yet depending on which professor they had or how long has it been between their genetics undergraduate studies, it kind of depends on how they're genetically prepared coming into PA education. This also, similar to what Maryann mentioned, also sets the students up with an understanding that what is to be expected throughout our curriculum to build on their genetics instruction here. So that really kind of helps level set, like we said, but also helps show them how it's applied in the multitude of areas in medicine that's to come.
All right. So it sounds like you're both having issues with level setting with students, making sure that they're all at the same level in terms of their genetics knowledge, and then also making sure that you have clinically relevant content to be teaching them that where they can grasp and really understand how genetics is used in medicine. Randy, can you talk a little bit about how the genetics and the physician assistant's practice course has helped you address the problem or the challenge of level setting with your students?
Well, actually, it works pretty conveniently for me, especially the asynchronous online format really fits well with our more introductory courses that very first year of their graduate phase. This is assigned to students, and as you actually just mentioned, there's 4 separate modules. Well, in our introductory course, there's actually 4 weeks of instruction in that course. So students are required to complete 1 module per week to not only that they can do it in their free time, they may be able to get caught back up and encourage kind of complete in any way, shape, or form they see fit. But also this helps establish that there are going to be concurrent deadlines throughout their PA education. So this allows them to really adapt to what they would say is very intensive, rigorous PA studies, but also be able to fit this in a more flexible manner.
Great. I'm really glad to hear that. I didn't know about the 4 modules fitting your 4 weeks. That's wonderful to hear. Maryann, can you talk a little bit about searching for clinically relevant content and making sure that genetics feels relevant to your students and how the course helps you with this challenge?
Sure. So similar to Randy, we let them know up front that this is what we're going to be doing. And I think the anticipatory guidance is really helpful. So they have the information in the syllabus, they know to register, and we actually encourage them to do some of the earlier modules at the beginning for that level setting purpose. But our big use of the course comes with the case studies. So we have 2 sessions where we use the differential diagnosis and management case studies. We divide the class into small groups and assign each one a case. So ultimately, we use all 4 of the existing cases. And we're excited to incorporate the 2 new ones as well. So we give, at the same time, we give the students access to a shared Google Doc that walks them through the cases 1 section at a time. So they have the HPI and the pedigree, and then the diagnosis and management plan, and finally the psychosocial issues and resources. And the reason we do it that way is we want them to see that many genetic conditions first present with common symptoms. So, things that might not be genetic at all, but then what are some of the red flags that they could look for that might raise suspicion that there could be an underlying genetic etiology? So they use that Google Doc to walk through it step by step. And then we also give them access to a shared Google slide deck so that they can organize the information to teach it to their classmates. So each group gets 8 slides. It's organized to fit the 8 learning objectives. Those 8 learning objectives map directly to that 2016 paper on physician assistant genomic competencies. We really wanted to be tight in the mapping there. And then we ask each group to self-assign different roles. So one person will be note taker, somebody else will draw the pedigree, somebody else does the research on the side, and then ultimately a few will present, with each group having about 8 to 10 minutes to share what they've learned with the rest of the class. And then that way there's peer teaching involved, and they're all able to use the shared Google Slides and docs as resources later.
Great. So it sounds like you're really taking the content that is present in the module and really adapting it to the way that you want to teach your course, doing a lot of peer teaching, a lot of very active, engaged work with your students.
Yes, that is exactly right. The whole course is designed to be student-centered pedagogy, operating under that 70-30 rule. 70% of the time, the students should be actively engaged in discussion, practice speaking, with only 30% coming from the instructors. So we have students watch videos in advance, and then the whole class period, we want them to be really taking the reins and applying what they've learned in an interactive way.
Wonderful. Well, great. This has been really wonderful to hear about both these use cases from both of you. Maryann, can you talk a little bit about any aspects of the course that you find particularly valuable to your teaching?
So you alluded to this, and I just want to double down on how highly adaptable it is. Every year we change it a little bit to fit what's happening in the zeitgeist and what are some current events, and how can we make sure that what they're learning is applicable to the other three threads in the course, and then we'll also position them well for the remainder of the curriculum over the time that they're here. So the adaptability piece is really key. I mentioned that we reformat it to use Google Docs, but that's super easy and fast, and we can update it as needed. Another big part of our teaching philosophy is around peer teaching. We know that it often results in better learning retention, deeper conceptual understanding, sometimes even higher academic performance, and it's all based on that protege effect. So making sure students can identify gaps in their own knowledge and then be able to convey that in a way that's relatable and personalized in the way they explain it to classmates. So I think it's really been a game changer in student engagement, knowledge retention, and then ultimately student satisfaction.
Great. That's wonderful to hear. Randy, what aspects of the course do you find particularly valuable for your teaching?
Now, I don't want to sound more cynical, but what I prefer is that there is a multitude of built-in features that ensure appropriate comprehension by the students. The knowledge checks, the interactive cases, this all ensures that the students don't simply click through or have this running in the background. It ensures their adequate comprehension. And then finally, there is those, like you said, before, there is those certificates per module and for the entire course that students then complete and turn into us as proof that they have conducted this exercise. So because we do it in an asynchronous manner outside of class time, this is also essentially able to kind of hold their feet to the fire and ensure that they are completing this necessary component.
That's great to hear. Yeah, it's wonderful to hear that the course works for the different ways that faculty want to use it, either having students really have a self-directed experience where they're really held accountable, or a more flexible peer teaching interactive experience. It's really great that it meets both those needs. Thank you so much for sharing that information. So we have some questions from the audience that I wanted to just pose to both of you before we wrap up for today. So we did have one question from a faculty member who is really concerned about the different levels of knowledge among students in terms of genetics, and cites that their program does not require genetics as a prerequisite. And so this person's asking, is there a required level of content knowledge to use these modules? And Randy, I'll ask you to field this question. What do you think about that? If you had a student who really hadn't done any genetics beyond introductory genetics, how do you think they would do with this course?
I would say the adaptability would have to do with the amount of time you assign the students to complete this course. If this is something where you see that the majority of your students don't have a very basic understanding of genetics and are finding this difficult, not only is it especially with some of the primers, the fact that it's divided into 4 modules, it tends to be very nice, very guiding, very rudimentary in the beginning to pretty advanced when we get to those cases at the end. So most students, I would think, across the board would be able to follow along. But if you find that individuals are finding this overwhelming, in my way of using it on an asynchronous, I would just simply give students a longer period of time to complete it so they can either utilize their additional resources, utilize their peers, or even now with some of the AI companions, to bring them to kind of even level set themselves before going into this module.
Right, great, thank you. And then Maryann, a question for you. You're doing a lot of adapting the content to the way that you like to teach your course. You cited a lot of, great theory behind the way that you're designing your course. In terms of the time that it takes for you to prepare that and do that, is that a really significant lift for you? What does that look like in terms of the time that you're spending as a faculty member to adapt for your teaching?
Yeah, very little. I mean, practically none from year to year. I would say the first year we put it into Google Docs, even less than an hour then. But now it's more of just making sure we're all ready and we know what the main points are that we want to remind students about. So I have the benefit of having some TA students that work with me to oversee and facilitate those small group discussions. So we make sure that we are aware of any advances in therapeutics. I would say that's probably one of the biggest things that students are interested in is what is happening at the intersection of genetics and therapeutics. And so we might add a little something there if it's relevant. And I also want to speak to the question you asked Randy about the level setting. I ask all the students in class one, what's your exposure, experience, and or interest? And then we use that to guide how deeply we go into other things in our discussions. And just, this is anecdotal, but a growing number are coming with a personal interest in some genetic condition or genetic counseling, genetic testing. And so I think that really ups the ante in how much they care about learning the material. It's not just scientific and kind of fact-based. It's got a personal meaning that makes them want to dig in and keeps them accountable.
Great, that's wonderful to hear. Maryann and Randy, thank you so much for joining us as panelists and for sharing how you use genetics in the physician assistant's practice in your teaching and for answering some of these questions today. I really appreciate it. So I'll just wrap up this webinar. Whether you're looking to set a foundation before diving into advanced content, or if you want to pull high quality cases into your own teaching module, or if you want to use elements of the course to dive deeper into a specific content area, the course is free, flexible, and it's ready to fit the way you already teach. We'd love to have your students using it this upcoming year. So thank you so much, everyone, for joining us today. We'll be emailing a recording of this webinar and links to the Genetics and the Physician Assistant's Practice course, as well as our entire online course catalog within the next day or so. In the meantime, please use the course link in the chat, which will be put into the chat shortly, to check out the Genetics and the Physician's Assistant's Practice course. And I'd like to wish everyone a wonderful summer. Thanks so much.